Microbiology. What is it, and what does microbiology have to do with you? This field of study is a key part of our world, from human and animal medicine to understanding the environment. On this show, Minerva Garcia, a practicing microbiologist, swings open the door to her lab to welcome you into this intriguing world. Now, let's meet Minerva, the microbiologist.
Welcome all to my show. Meet Minerva, the microbiologist. My name is Minerva A. Garcia. I'm currently the Associate Director of Microbiology at Jacobi Medical Center at New York City Health and Hospital Corporation in New York City. I am your microbiologist. Now again, microbiology with the microbes welcomes you in. And so does poetry with creative lines. So there it is. Goes an analogy of a poem. Since COVID pandemic, we've been rearranging our lives and as we face the many challenges. This is where poetry comes in. I'd like to bring to you all into my world of microbiology, where microbes are discussed and poetry expressed in a way that is easy to understand, follow, and viewed. Without poetry, the creative minds gets lost and is found through poetry. So poetry right now is really our salvation, and we have known that throughout history. So let's get into it. So let me discuss. In microbiology, we can get lost by this terminology and all of its different microbes, leading to the microscopic worlds. But with a microbiologist looking after you, you once again can be found and be cured. So come into my worlds of both microbiology and poetry. So there it goes. An analogy of a poem titled Challenge. Challenge is facing obstacles, never giving up. It's combating a disease and rising each morning with the sun, with a smile. It's comforting those in distress, even if you are there, and are realizing you're human, but that you can give a loving hand. It's loving your fellow man, even though there's none for you. It's getting wet, but no umbrella are in your hands. It's opening up your heart and filling your soul with love. It's giving hope and strength to those who lack. It's being kind and sharing yourself with those in need. It's searching for peace where there is none. And it's to seek liberty and live harmoniously despite what you may see, but to stand by your beliefs. To challenge the court for the truth is a view. For God, the innocent, why there is crime. To question the unbelievers, evildoers, the pessimists, or could not be the key. The beauty exists when you believe people like this. Breathe free and surely rest in peace. So let's get started. In today's show, I'd like to talk to you about April, why it's so important to our profession, how we celebrate, minority challenges in healthcare setting, and what's up with COVID. So let's start. Let's get started again. In month of April, we are so important to our profession. Why? Because the 4th week of April is National Administration Professional Week, known as Secretary Week. We also have 3rd week, Lab Week, Medical Lab Professions Week, and also Poetry Month. Both my passion. It is also Minority Health Month, all vital in the operations of the healthcare settings. Lab Week. Lab Week is we all have all the fun and celebration begins. It is a place where silent heroes work. This year, our logo is Laboratory Professionals Get Result this week. It's a show of camaraderie with posters, puzzle, raffles, gifts, t-shirts, pens, mugs, with our logo are distributed to lab workers. Luncheon, dinners, and appreciation are acknowledged by administrations and the Harvard CEO, CFO, and down to the health corporations and its association, gains such as Meet the Microbe, most famous and hated pathogen, showing no discrimination, loving us all. This is part of a celebration in microbiology. It is the universal pathogenic mutated winner this year being SARS-CoV-2, luckily being deterred and destroyed very slowly through a vaccine. This will be our only hope as controlling and stopping this pathogenic virus from mutating and moving on. We have the power to stop it, so let's all get vaccinated. Minority challenges in healthcare setting and overall. Next discussion. Minorities are disproportionately in the healthcare setting. We may ask why. The reasons are vast and many. Some of the challenges facing minorities are lack of support financially from their families, where to turn for mentoring, assistance from furthering their education through scholarship and grants. Their culture does not encourage upper higher education in many instances. Probable marriage or work usually encouraged. They may feel that it's difficult to succeed in the sciences, and instead they seek easier majors. The profession is too lengthy compared to other fields, many fields. The sacrifice they may feel that is not worth time and the energy. Minority students may not have the same strategic mindset as that of an educated and supportive family system. Therefore, they face many obstacles, and above all and beyond, hard to imagine. You have to put yourself in their shoes in order to understand. It is a difficult road and not easy one. It takes a lot of sacrifices and understanding and support from your family, loved one, and members of the community. It really takes a village to succeed. If you want it so bad, because it's the only way out of poverty, survival, and most of all, a way to make it better for you, yourself, and the next generations. So sacrifice is always there. You have to look in a way outside the box, disregarding and ignoring those whom will not support you, encourage you, nor give you the run like a marathon you need to succeed and accomplish your goals. You have to have a plan early on. Seek a mentor. Have strategies. Distance yourself from negative people who will not support or encourage you. Seek assistance from your teachers. Join a club and start one. Join your local community volunteer group. Learn to give of yourself. Be an ideal citizen. Most of all, stand out. Be a leader in your school, in your church, your community, aiming to be the better person early on. Don't hesitate. Keep going. Don't stop. I suggest the harder your roads, the journey as a rainbow you'll get at the end of the road. I'm sure you'll get it if you work really hard at it. I'm indeed your example. I always follow my dreams, being respectful, always love what I do. Just continue searching to make this world a better place in this journey of life. We have seen people today living longer, where health indicators show that life expectancy is improving by exercising, eating right, eat the right food, better nutrition. We also may think that infant mortality has improved, but we are facing today many challenges of disproportionate levels. Minority is no better. We, a minority, are facing many challenges, but you also have to not give up and face it heads on. This includes issues today that we are facing, such as global warming and now the epidemic crisis of COVID, where we all as a society must come together with a unique understanding and awareness, with an effort that together we all must work as a family in one unit, all together in order to sustain this planet and survive, leaving our future offsprings a better future and hand them a planet with a better tomorrow and promises. We have to relearn what is important. We have to question what are we leaving behind, and what are we moving forward, and how can we move forward? By respecting our planet, our oceans, the forests, and the very air we breathe from pollutants such as acid rain, plastics in our oceans, and cutting trees, leaving us all vulnerable to microbial pathogens. The environment where they live is no longer there and is no longer safe. So they're moving on to other ecosystems, affecting us all negatively. We must respect them. The future belongs to all of us. Therefore, it's up to all of us to love it, see it, and protect it. We have, as Americans, must find a way to improve our minority to seek a better medical care and medical community for them. Join the health professionals and join the fight of preventable disease that can be prevented. As learned with COVID pandemic, we have seen that working together, follow proper protocols recommended by the CDC, WHO, the World Health Organization, such as wearing masks, staying 6 feet distant, covering your face with a mask, cover your nose, cover your eyes, proper hand washing, 20-30 seconds lathering with soap to shed off those pathogens on your hands, taking on responsibility as a citizen to ensure our safety by getting vaccinated, to develop immunity. All these regimens are extremely important and critical to follow, which I have been encouraging throughout my shows. Please do not stop and continue. We know the minority faces challenges that are too difficult to solve alone. Therefore, a support system will be beneficial for them enormously. So, for example, we have many physicians with MD degrees from their foreign countries. Due to language barriers, difficult passing the medical boards, taking classes has limited them to get actively involved as they would like. So practicing medicine would not be a very good way or way of them for life. How can we change that? We are missing out on these intellectual minds. As we have faced shortages, a support system will encourage them to succeed. We have seen issues with global warming and the pandemic crisis. Therefore, we know that these students have faced just same challenges. So let's encourage them. Take one as a mentor and encourage them. Students face also financial assistance. They could get financial packages and also scholarship from the schools and student loans. Therefore, students should make every effort to seek a way to fulfill their dreams and not get discouraged in the medical profession. It is critical and one of the most important for students to understand not to be fearful, not to have insecurities and difficult in applying to medical school or to science program in colleges. Applying to a life in the laboratory profession is very critical, so we are facing tremendous shortages right now. It is very important and rewarding field because 70% of diagnostic testing performed yearly in physicians rely in order to treat their patient. Laboratory testing are performed and daily monitored and reviewed and submitted to physicians to treat their patients successfully. If this is not rewarding, then you tell me what is. We in the laboratory are facing tremendous shortages. We know that if baby boomer generations are retiring, this population are highly motivated, highly educated. We will be seeking the best healthcare system for treatments. We know students to join the laboratory profession to fulfill their retirees, and you all are welcome in. So please come into our profession. We need you. It will be your turn to carry on and take this baton from us. We will pass it on to you. You are the future and representation of our generation in this profession of the laboratory. I'd like to discuss some discrimination that some communities are facing. One is the LGBTQ. Lesbian, gay, bisexual, transgender experience poor health services and its outcomes than their heterosexual community. You might ask why. This is because of the following. Poor outcomes being result of differences in access to health coverage, limitation available to them. because the absence of medical settings that are affirming and free of discrimination. Medical staff not trained in LGBT health issues. Health behaviors that do not foster good health. Social and economic systems that have not supported and protected this minority group. Fear of repercussion from family members. They also don't feel comfortable relating to issues in an uncomfortable setting. Statistics indicates that 29% have said that healthcare providers refuse to see them due to their actual perceived gender identity. This is sad news to learn. Learning of this information from CAP survey from 2015 is sad. It saddens me really to learn that we as human beings are created equal. Are we really? So we are all created with equality. The medical community must be open to everyone without prejudice. Improvement in this area must happen in the future. Now, not later. Immigrants. Immigrants is another in the community that are not getting the support they need. They fail to seek medical care because of the immigration status, lack of language understanding, and the lacking of health insurance. In their culture, many do not wish to exercise their will by being forced to examine by the opposite sex clinician. It is important in the control of diseases and to maintain a health and healthy lifestyle by visiting your physician and seeking health care when a person is ill. This is very crucial for health care improvement in helping the community to improve their health. Preventive medicine is also critical, and good hygiene practice is essential in improving and maintaining good health. Latinos and many African Americans also are lacking of health insurance, which raises a huge problem beyond recognition, because by the time they reach a physician, it may be fatal. The reason being, they do not follow up with their clinicians due to the lack of insurance. Many of them visit ER for critical care that require further evaluations and treatments. This is a huge problem that creates another crisis, not easy to manage. Therefore, it's important as a society to understand minority groups and give support where it's needed. Many times they have nowhere to turn, but to hospital emergency rooms, this can be costly and detrimental, causing a huge burden to the healthcare system. What can be done to improve this area? As society, we got to have an understanding of these groups and be compassionate if we are to move forward and show team efforts as a team player. What's up with COVID? We know that right now we have variant strands. The only way to control COVID is continue vaccination. You must continue wear your mask, use your mask completely. Do not discriminate. You must use proper hand washing, 20-30 second lathering. Very important. Encourage your friends, encourage your families. That is extremely important. This shows is available at Apple Podcasts, iHeartRadio, and Stitcher. I want to give a huge shout out to Mary Lou Davidson. She's my executive producer and president at Scott Media Strategy at Web Talk Radio for making all this possible and allowing me this huge opportunity to reach you all. I also like to thank my loving, supportive audience. Thank you so much. You're hearing from the microbiologist Minerva A. Garcia from Jacobi Medical Center. The views and opinions expressed in this radio podcast are solely my own and my guests and are not of any institutions or corporations. Thank you.